Hello everybody, welcome back. This is Dr. Marc Dupéré, plastic surgeon at the Visage clinic here in Toronto, Canada. Thank you for joining. I'd like to show you two of my favorite facial implants, and yes, there are many types of facial implants, but today on this video I'd like to talk to you about chin implant and temple or temporal implants. Yes, temple implants. So chin implants have been around for a long time. They've been used commonly for ladies and gentlemen with weaker chin. They come in 13 different models. So for guys, girls, depending on the shape of the chin, depending on what they would like to get, depending on the inclination or the angle of their chin. But overall, they're used to augment the projection, to reach a better harmony between nose and chin, which is crucial. But also nowadays, I use them in 90% of my neck lift and facelift in order to help the neck and the skin to be nice and taut. It also helps to restore youthfulness because we do lose bony structure, bony material as we get older. Chin implant come again in many sizes, many shapes. I will show you this is more a very oval shape of implant to ovalize. I use the word to ovalize to make it more oval. The chin, we have this one extended chin implant. I use the most for our ladies, where the wings here, the little ears here, help to blend into the pre-jaw area. This is very commonly used in facelift today in my ladies, and the male version is a little bit more square, and I use it also for guys who want to look very natural, who need some augmentation, also for the pre-jaw in a facelift. And then for our guys, we have other one. They're different shapes. So if somebody wants a very wide square chin, we have this one, and we have this other model here for guys. In all situations, there are two ways to insert those implants. They can be done via a submental incision. It's a common incision nowadays to use because it's the same incision we use for a neck lift. The other incision would be intraoral, so we still use it periodically where we go inside the mouth. There's a slight increased risk of infection, but very negligible. Chin implant is a very important procedure that makes our facelift and neck lift not only look better, but last longer. So chin implant, common procedure, fairly small addition in a facelift. It's also a relatively easy recovery. Incision under the chin, few stitches for 1 week. I do like to wear a garment for a week or so, most of the time, just to apply a little bit of pressure to help with swelling. If it's a primary chin augmentation, I just secure the implant with stitches. We develop a pocket that's exactly the size of the implant, so there's very little chance of movement in the implant. If we go a second time, let's say a patient had surgery somewhere else and we're going with smaller or larger, sometimes I use a stronger fixation like a screw, but this is very rare. Now the other implant I like to talk about is the temporal implant. It's been around for some time too, but people are not really aware of. Hollowed temple is a sign of aging. It's also a sign of some chronic condition, chronic illnesses. So we like to fill this temple with volume. We can use fillers. Fillers are very commonly used for temple. It's a very quick fix, done at the office. Needs to be repeated every year, a year and a half. But filler is a great way to augment volume. If somebody wants something more permanent, then comes the temporal implant. They're called temporal shell. They look like shells. They come in different thickness and different height, depending on the anatomy of the patient, depending on the look. In a male, we don't want round temple. We want something still fairly square. In our ladies, we want something a bit rounder. That will be one way to choose an implant. I've got patients with very short head, rounder face, so we go with a shorter implant. And I've got those longer face, lots of hair or exposure of the deep hollow, and we'll use longer one. Now, all implants are carvable, so sometimes I need the longer implant. I develop the pocket. The pocket is done or achieved through an incision in the hair, in the scalp, where we reach a fascial layer and we go under the fascia. Fascia is a strong white layer over each muscle, and the temporal fascia is a thick, good, strong fascia. So we inside the fascia, we create the pocket, we go within the crest of the bone here to the zygomatic arch here, and we insert the implant into that pocket, and the incision ends up being hidden in the hair. The recovery is fairly fast for this procedure, the incision being in the temple. Bruises are very rare. Most patients can resume normal working activity within 2 to 3 days. So I've got those 2 implants in my practice, which are very common. This is in addition to cheek, jaw angle, nose, tear trough, and perinasal implants. Those are by far our most commonly used, and I love them. Makes my result look better, makes my patient happier, and makes our result last longer. Thank you for watching. This is temporal implant, temple, and chin implant in Toronto. Thank you.